I'm an otolaryngologist in practice in Bethlehem, Pennsylvania. I have experience in the modern era of posterior nasal nerve ablation since the tail end of 2016. I started offering the NEUROMARK procedure in the tail end of 2020. Chronic rhinitis is a broad diagnosis, okay? So as an umbrella term, and this may surprise some people, I will say that as many as 35% of patients in my practice come in regarding chronic rhinitis. So most patients coming in with any nasal complaint, be it congestion or runny nose, really are coming in from rhinitis. Prior to some more recent interventions, we haven't had tools to really help people with some of their symptoms, runny nose or rhinorrhea in particular. So oftentimes in the course of what I do, people will talk about new interventions and treatments, and people are quite excited to know that there's something that can be done to help their symptoms. In terms of patient preparation for treatment, I think that it's super important to set expectations, because a comfortable patient makes for an easier treatment or procedure, and knowing what to expect certainly helps that. So I'll share information about relative efficacy by experience, by what's published, in my own experience, the chance that it'll help them with their symptoms overall, and what degree or percentage change on their symptoms because they might expect, because having realistic expectations is quite important, okay? So here I always tell folks that we're looking for significant improvement, not necessarily cure. Being able to do so under local anesthesia, in the office setting, in a relatively efficient time period, with what I find to be a very clean side effect profile, is also really, really appealing. So I'm not saying it's sensation-free, but knowing that my patients can stand up and walk out and set up their follow-up appointment, sit back in their car and drive home, I find that to be very, very nice. The actual treatment time can vary from patient to patient because it's not based on simply counting seconds or temperature. It's based upon what I would call smart technology. The NEUROMARK device telling me by measuring impedance that I've delivered adequate therapy to accomplish treatment. Patients can notice relief, believe it or not, as soon as 1 week. I would define success as a happy patient. Did they obtain symptomatic relief to a degree that they're happy with, okay? So that's my ultimate measure of success. But overall, I've been really, really happy. The ease of use, the success in the terms that we discussed earlier, avoiding some of the things that people would like to avoid, discomfort in the course of treatment, avoiding things that I would like to avoid, predictability in my ability to treat a patient in an efficient fashion and to have them get up and walk out. It's disrupted to office schedule if it goes otherwise. So for all these reasons, this is my preferred tool to treat.